All right, well, thank you everyone for joining the sixth and final program of the Bar Association's Professionalism Committee's Virtual Wellness Series. All of our programs have been great so far, and we're excited for today's program presented by our returning guest speaker, April Luby, on stretching for stress relief. You may recognize the last name because she is married to our fellow member, Dave Luby. And I hope she uses him again as a test dummy, which was her term of affection. I want to remind you that you will be muted throughout the program, but if you have questions, either put them in the chat box or hold them until the end, and April will address any questions that you have. So with that, I'm very pleased to announce April Luby. She has been working as a physical therapist assistant for over 10 years in the outpatient setting. Her experience lies with a variety of orthopedic conditions, and she enjoys working with a variety of patients, including geriatrics, injured workers, and post-surgical rehabilitation patients. April enjoys providing continuity of care for each physical therapist that she works with. April has been a caregiver for over 20 years and is passionate about caregiver education and patient advocacy. April is a certified exercise physiologist with the American College of Sports Medicine, a certified workers' compensation healthcare provider with the International Sports Professionals Association, and a member of the American Physical Therapy Association. April and her company are always accepting new patients. So for any personal injury, workers' comp attorneys out there that have clients that need care, please reach out to April and consider her and her company, which I'm sure she will plug throughout. April will be launching her new blog, careforthecaregiver.com, very soon as a resource and interactive community for caregivers. So we're very fortunate and thankful for April's time to present on today's topic, stretching for stress relief, which is something we have all needed since about mid-March. So without further ado, I'll pass things over to April.
All right, thank you, Bill. Welcome, everyone. I am going to take you through a sequence. It's about 30 minutes long, and it's a series of stretches that I give to my patient, especially my professional patients, to help them work through some tension and stress for those, especially in your position where you're in a high stress job pretty much all of the time. If there's any questions throughout, just kind of flag me down or keep them till the end, and I will make sure to save time to go over anything that you have questions about. My goal is to teach you a little bit about stretching. Stretching should never hurt. We all have tight muscles and we all have different things going on. So you always want to check with your doctor for any type of program. If you have any disc issues or any fusions or surgeries or any previous things like that, always make sure that you check with your doctor. And throughout this program, make sure that you just stay in your comfortable range of motion. So there is no right or wrong. When you stretch, you always want to make sure that you're stretching just to the first resistance. You don't want it to be painful. If it's painful, you need to ease off your stretch or you need to check your form. So the first part I always start with is our neck, because usually, especially for my females, we carry all of our stress in our neck and our shoulders. And it's pretty universal, but I would say most of our females patients and my female lawyers that I have treated, a lot of their headaches and their pain come from stress and tension in their neck. Okay, so what you need to do is I'm going to switch the camera in real quick just to show you what you should look like on your thing. So bear with me 1 second. So when you are in your chair, so I said most of you said you had a dining room chair. So I just want you for this one to sit all the way back in your chair so that your back is as straight as you can get it and that you feel supported. Your feet should be flat on the floor, no crossing your legs. And the first part of it is we're going to do from just shoulder up. So I'm going to show you and I'll switch that camera angle. But just make sure you're kind of in a comfortable position, a little bit away from your desk. And again, all of these exercises are set up so that you can do them at your desk during the workday. And then if you're interested, I have a series called the Mobility Minutes that I created for some of my patients. And I'm going to be creating a handout, and I'm happy to send that to anyone or give Rachel a link to that document so that you have a printed version of that mobility minute so that you can have that for future reference and throughout the year if you need it to help reduce some tension. Okay, any questions so far at all? Okay, so first thing we're gonna do, we're gonna sit up nice and tall. Your core is gonna be activated, so you wanna just tighten your tummy muscles a little bit. You're gonna tilt your right ear to your right shoulder. And when you do this, you wanna make sure that you're looking straight ahead. You don't wanna rotate your head. If you wanna add a little bit more pressure, you can take your hand and you can lay it right over top of the top part of your ear. You don't wanna pull, you just wanna feel the stretch. Your left arm should just be resting at your side, or you can grab the chair and you can kind of lean away from it a little bit to add a little bit more of a stretch. Does everybody feel a comfortable stretch with that? Now, if you have neck issues, you just want to tilt the right ear to the right shoulder just in your range of motion. All right, now we're going to switch left ear to the left shoulder. You can add that extra here, and you want to hold your stretches between 15 and 30 seconds long. For the purposes of the presentation, I'm going to try to stick to about 15 seconds. And at the end of the presentation, like I said, when I said the mobility minutes, I will send kind of instructions for stretching and just like a little handout that goes over everything that I walked you through today. Good. We're going to switch one more time, tilt the right ear to the right shoulder. You can add that little bit of overpressure. And again, you're making sure that your back is straight and supported. And to make sure here. And last one, left ear to the left shoulder. And you want to make sure when you grab that, put that hand over your ear, you want to make sure that your shoulders stay relaxed. You don't want to hike your shoulders up. And well, hold on one second. I think that I can set this for a mirror image. Give me 1 second. That way won't confuse everyone. Okay, I'm not sure how to switch it to the mirror image, but if whatever I'm doing, you're going to do the opposite side. Sorry about that. That's one thing I'll fix for next time. All right, so the next exercise we're going to do is we're going to make sure that we do just a little bit of shoulder rolls. So you're going to shoulder rolls backwards. You always want to make sure you keep your back straight and just nice and easy, nice, slow, large shoulder rolls. Good. Second exercise is we're going to stretch out the levator scap. This is usually a lot of problems with your upper trap. So the upper trap is the first muscle that we stretched. Now we're going to stretch the levator scap muscle. So you're going to turn your head to the right and you're going to look down like you're going to smell your armpit. If you want to add that overpressure, you're going to add just to the back of the head here. So if you're turning to the right, you're going to use your right hand to add the overpressure on the top of your head. And you're going to come out of that nice and easy. You're going to rotate your head to the left. You're going to look down like you're going to smell your armpit. And you can take your left hand and you can add that little bit of overpressure. Again, your feet are flat. Your back is supported by your chair that you're in. Keeping the core tight, relaxing your ears away from your shoulders. Good. And we'll do that one more time, turning to the right, looking down. You can add that overpressure with your right hand. And then relax. And again, turning to the left, looking down, keep those shoulders away from the ears. If you want to add a little bit more of a stretch, you can, if your head is to the left and looking down, you can take your right hand and you can put it behind your back. And that'll give you just a little bit more of a stretch. Now, when you're doing these, you want to make sure that you're not rotating your body, because most of us have the wheeled chair. You don't want to rotate your body with it in the chair. You want to make sure that you're just rotating your neck. All right. Next exercise we're going to do, I'm going to show you from the front, and then I'm going to turn to the side and show you. It's called a chin tuck. So if you have a high back chair, that will work to your advantage. If you don't, that's totally okay. So you're going to keep core tight, shoulders down and back. You're going to take 2 fingers with your right hand, and you're going to place them on your chin. You're going to do what's called a chin tuck. So I want you to think about creating a double chin. I know nobody really wants to create a double chin, but it's the easiest way to explain it. So you're going to tuck your chin back, and you should feel a little stretch right in the back of the neck, those smaller neck muscles. Shoulders away from the ears, and then relax. So from the side, just to be dramatic, to show you the difference, this is a protraction, this is a chin tuck. So it's not a nod down, it's a tuck back. You're gonna hold that for 5 seconds, and we're gonna do that 3 times. So taking the 2 right fingers, tucking the chin back. And again, that's why you wanna make sure that you have that support through your lower back, so that you don't arch your back when you're doing it. Does anybody feel any pain or discomfort with that at all? Everybody feel that little bit of a stretch? Okay. All right, we're gonna do 2 more. We'll tuck the chin back, 5-second hold, and then relax, and 1 more. And relax. So that's a really good one if you've been stuck kind of looking at documents a lot and your kind of head has been in one position for a long period of time. You can do that chin tuck exercise. You can use a towel roll in the small of your neck, and you can do it against the wall, or you can do it lying down with a little neck roll for your pillow, and you can tuck down into the pillow laying down on your mat. But I wanted to show you everything that you could do at your desk today. But there are multiple positions and ways that you can do those different types of stretches. So the next stretch is you are going to stay seated in your chair, feet are flat, and you're going to bring your arms out in front of you with your hands together. Now this is where you'll need a little bit of space, because you're going to kind of use your, if you have a wheeled chair, you're going to use that to your advantage. So again, your back is supported, and you're going to take a breath in, breathe in your nose, then you're going to exhale and rotate back. So this is going to get you a little bit of thoracic rotation so that you can stretch out that mid and that upper back and get you a little bit of rotation instead of being stuck in one position. Okay? And you're going to open up. And so every time that you're reaching back, you want to make sure that you're exhaling. And then coming back nice and slow. And reach back. And then exercise. Good. Shoulders are staying away from the ears. You can do the same thing standing up. Okay? So I will show you the different angle. And if you are here, you can stand up, put your left foot in front of your right foot, and you can do the same thing, opening up, and you'll get a little bit of stretch throughout that whole right side. And then you can do the same thing on the opposite side. All right? So the next exercises that I'm going to show you, I'm going to keep this angle here. If you have the dining room chair, you're going to do this a little bit differently. So the first one I'm going to show you is with the wheelchair, for those that have that. I'm sure everyone's familiar with the child's pose stretch if you've done any type of yoga or anything. If not, no worries. This is a child's pose stretch that you can do at your desk. So you want to have a little bit of space, or you can go to a different area and do the same thing on the floor. But if you're at your desk, you're just going to put your hands on your desk, and you're going to keep your back straight, and you're going to push back with your feet, and you're going to stretch back until you feel a stretch in your lower back. You're going to hold that there for 30 seconds. Now, if you have a limited space or you have the dining room chair, what you want to do is you're going to bring the chair back as far as you can get it. You're going to sit at the edge of the chair, legs wide apart, and then you're going to slide your arms forward versus pushing back with your hips, and you're going to get the same stretch. Does that make sense to everyone? Any questions about that one? Now there's a couple variations of this stretch. You can take your right hand, put it over your left, and you can stretch that whole right side. Then you can come back to center. You can bring your left arm over your right, and you can stretch and stretch out that whole left side. And that's the way you get a nice rotation through your lats and through your QL, which for you guys who are sitting at the desks or in court all day long, those are the muscles that tend to bother you the most. So before we move on, I just want to take any questions anybody has or any questions about those stretches so far, or any comments at all? Just to make sure I cover everything. For the wrists? Okay. That's funny. That was my next one. So good. All right. So for your wrists, a lot of times you guys are stuck in a position where you're typing a lot. So you can take hands, you can do a prayer stretch. So what you'll do is shoulders away from the ears, bringing just like you're going to pray, and you're going to bring your elbows up as you push your hands together. But your shoulders should stay down. And you're just pushing until you feel a little bit of a stretch on the underside of your wrists. In the same respect, you can take your hands and do an inverted pear stretch, and then you're going to try to keep your hands together as you press your elbows down. For this one, you won't get too far because you'll feel the stretch pretty much right away. But those are really good stretches for the wrist. Another way to stretch the wrist is just keep your arm out straight. Take your hand and pull up with the opposite hand. That'll stretch out your wrist flexors, which are the muscles under the arm. Same thing, you can stretch down. This one is a really good one for you guys because you're in that flexed position all the time. And this will stretch out your extensors to keep your wrists in a little bit more neutral. Any questions about anything else? Any other ones so far? Okay. So I'm going to switch the camera angle again, and then we're going to go through some of the other lower body stretches that will help everyone out. Give me 1 second. Good. Okay. Our next exercise is to do our glute stretching. So you're going to sit in your chair. And for this one, doesn't matter what chair you're in, you're going to sit at the edge of the chair. All right. Feet flat. You're going to bring your right leg up over your left leg. Now, if you have mobility issues or if you have a tight hip, you want to make sure that you are able to do this pain-free. So what you can do is you can straighten your left leg a little bit more instead of having it bent. And then you can bring your leg up, and then slowly as you're ready, you can inch your leg up. If you feel a stretch just getting into this position, you do not want to add any overpressure. You want to make sure that your back is straight and that you're sitting at the edge of your chair. You're going to gently add a little bit of overpressure to the right top part of the right thigh, and just add a little pressure, and you should feel a stretch in that right hip. Everybody doing okay? This one's usually a tough one. Usually tight on most folks. The other thing that you can do is you can switch it, and you can grab your knee and you can hug towards your left shoulder. So that's a way to stretch out the hips and the glutes as well. So now we're going to switch to the left side, bringing the left over the right. It's also very common for you to be tighter on one side than the other. So you may be able to easily do it on one side, but you also want to make sure for that tighter side that you stretch that a little bit more. So again, back is straight, shoulders are away from the ears. You're sitting at the edge of the table, keeping pressure Left hand to the left knee, just a little bit of overpressure. If you want more of a stretch, then you can lean forward at your hips, but you're keeping your back straight. And you should feel a pretty good stretch at that point. We're going to switch back over to the right side, bringing the right leg over the left, sitting up nice and tall, shoulders away from the ears. Everybody feeling a decent stretch with that one? This is usually my patient's, I hate it the most, but I love it the most, stretch. All right, after that, we're gonna move the chair back, and you just need space so you can stretch your leg out. I'm gonna fix this angle just a little bit. All right. So for the hamstring stretch, this is the stretch that everybody loves to hate, okay? I'm gonna sit at a little bit of an angle so that you can see. Again, you're sitting at the edge of the chair, you're straightening your leg out. If you have a little stool, the little stool is your friend. You can use a book, you can use like an old phone book, if everybody has that. Everybody's seen the old phone books. I'll show you what I mean. This is one of my coaching course books. You can use that as a little stool, sitting up nice and tall, and you're gonna lean forward, and you're gonna pull your toes towards your nose. And you're gonna keep that nice stretch. You're gonna hold that. The hamstring stretch is the one that I want everybody to hold for 30 seconds, especially my males. You guys tend to be super tight in your hamstrings, and most of the time don't stretch your hamstrings at all. And this is what a lot of back pain is caused by, really tight hamstrings, because it pulls on your pelvis and it changes your alignment. And in my males, it's a very common cause of their lower back pain. So again, back stays straight, leaning forward, just do a comfortable stretch, pulling toes towards the nose to get that nice hamstring stretch. We're gonna switch to the left side now. Straightening that leg out. Back is straight, leaning forward at the hips, pulling toes towards the nose. And the hamstring stretch, you should feel it. If you're really, really tight, you're probably gonna feel it just below the back of the knee, but most of the time you should feel it in the back of the leg. And again, you're only going to a pain-free range, nice, comfortable stretch. Good. All right, last exercise that I wanted to go over with everyone is the hip flexor stretch. Change this angle just a bit. So hip flexor stretch is one of those stretches that you can do with your chair. You're gonna stand up, you're gonna put your right knee on your chair. Then you're gonna place your left leg a little bit more forward. Let me get you a better angle. Sorry, guys. I wanna make sure that I get the best angle possible. There we go. All right, so right knee is on the chair in a comfortable position. If your knee bothers you, you can take a towel roll, roll it up like a donut, and you can put your knee into the towel roll to take off some of the pressure of your knee. But then what you're gonna do is you're gonna hold on to the back of the chair. You're gonna bring your left leg pretty far forward, as far as you're able to, and then sit up nice and tall. So you're gonna kind of tuck your butt, and you should feel a pretty good stretch across the front, if you can see my hands, across the front of that hip. You're gonna bend your left knee forward to feel more of a stretch, but you wanna keep your hips tucked so that you feel that nice stretch. This is one of those exercises everybody loves to hate, but everybody needs it, especially for you guys as my lawyers. You guys are sitting in an office position when you're doing longer hours. And so anyone that's in a desk chair a lot, I recommend doing this every hour to help you keep those hip flexors from getting tight and pulling. And again, one of the primary causes of back pain, even though it's on the opposite side. So then another way to do this exercise, I'm going to show you, we're going to stretch the other way, is just to stand. You're going to bring your right foot forward and then push your left foot back. So almost like you're about to get into a lunge position. You're going to keep your bottom tucked. So we don't want to arch our back. We're going to keep the bottom tucked, and you're going to bend your right knee forward, and you should feel a stretch across the front of that left hip. A variation, if you want a little bit more of a stretch, you want to make sure that you stretch up, and you can stretch your arm up towards the ceiling, palm out. Good. And then holding there. All right. So that is a series of exercises that you can go through on a daily basis to help you reduce stress, especially when you're at your desk for long periods of time. And I will take any questions, or I can show any other exercises. If you want to unmute them, Rachel, and I can address kind of anyone's questions. I'm trying to look through the chat.
April, I put a question up to everybody before.
Sure.
Just talking about, you mentioned about being tighter on one side, and I imagine that we're all in that same boat where either one side is amazingly strong and loose and the other one is like a can of worms. Any advice for trying to, at least ergonomically, what we should do, shouldn't do, what we are doing, that's contributing?
So if you get a chance, last week I did a ergonomics series about work from home ergonomics to talk about like your positioning at your desks.
Sorry.
No, don't be sorry. There's a recording there, and I can always I can give you my email and phone number, and I can always kind of talk you through anything, and you can kind of put me on FaceTime. I can see your desk. Your setup for your workspace is pretty important. It will help. It doesn't fix your problem, but it helps from creating more and more problems. So in general, it's common for people to have low back pain. It's common for people to have one side tighter than the other. What a physical therapist does is they show you parts that need to be strengthened, but parts that need to be stretched. So sometimes people, will watch something and they'll say, okay, well, I've been stretching. Well, the problem is that you're stretching, because if you're stretching something that doesn't need to be stretched, you're putting yourself at more risk. When you're tight like that, one side more than the other, usually it could mean that there is like an alignment issue, and a physical therapist can check that out for you, or it's how your posture is. If you're right hand dominant, people tend to be a little bit tighter on the right, so you have to stretch out those sides. But it's not something that it can be caused by something, but it's very normal because you have a dominant side to be tighter on one side than the other.
Thank you.
Mm-hmm.
April, to follow up on Mary's question, is it the right thing to do to like spend more time stretching on the side that is tighter than the other side to try to equalize them?
Say that you definitely have to stretch both sides. I don't think that you need to stretch side completely one way or the other. I would just say gentle stretching on the good side that maybe doesn't need it. But doing a good stretching and mobility series is really important for you because it keeps your body mobile. For you guys, you're sitting, not that you sit at a desk all day, but if you're pulling long hours and you're, looking over medical documents or things like that, and you have thousands of sheets of paper in front of you, or you have to stare at a screen all day, you're in a flexed postural position all the time. So if you don't stretch out the front part of your body, you're just going to continue to get tighter and tighter and tighter. And if you already have a low back issue, which a lot of people do, unfortunately, or your core is not activated properly, or you're not activating your glutes properly, what happens is that dysfunction starts to spiral effect. So it's just kind of like a domino effect. And that is when you start to feel the pain, or you feel more swollen on one side, or sometimes you'll feel in your neck, you'll start to feel like numbness or tingling in your hand. And that's a sign of something's getting pinched, something's out of balance or out of whack. And you have to do some stretching at first, change your postural position. And if it persists, then that's when you know you need to go see a physical therapist and get addressed. Any other questions? Did that seem helpful? Does everybody feel a little bit looser? I just want to make sure that I'm addressing any other body parts or things that people want to take a look at.
Dave doesn't look.
David Luby is the worst patient ever.
If I listened to her more, I'd have no problems whatsoever.
April, thank you. That was great.
Sure, absolutely. So the last thing I did want to walk everyone through is what we call diaphragmatic breathing. So I know that we all know how to breathe, but most of us do not know how to breathe properly. So what I want to show you is when we breathe, a lot of people breathe through their mouth and they do a lot of accessory breathing. So where they're just nice, they're constantly, your shoulders raised and things like that. Diaphragmatic breathing is how you actually open up your chest cage, open up your inner thoracic cavity so you actually get more oxygen in and get the rest of that carbon dioxide out. So what I want you to do is sit at the, sit supported in your chair as best you can, sitting up nice and tall, feet flat. I want you to, I'm gonna put this on my stomach, God forbid. I want you to put your hands on your stomach, just like this, all right? And you don't have to intercross them, you can just put them lightly one over the other. So I want you to take a nice deep breath in your nose, but I want you to keep your shoulders relaxed. You're gonna breathe in your nose for 3, hold it for 3, exhale for 3. Now, by looking at the pictures, everybody lifted their chest up. So now this time, what I'd like you to do is when you inhale, when you take that 3 count breath in, I want you to fill your hands up with your stomach, okay? So your stomach is actually going to expand, okay? So nice deep breath in. Good, hold it, 1, 2, 3, and let it out. And then your stomach should flatten, okay? So that's what we call diaphragmatic breathing. I know, I wish it would just immediately flatten for all of us, but that 3 count in, 3 count hold, 3 count out. That is a really good way to start off your day. It's a good way every hour, like if you're stressed, that's a good way to kind of stop and do like a series of 5 to 10 of those 3, 3, 3 count. It's a way to kind of reset your body. Again, it helps you get more oxygen in and get the bad stuff out so that you can actually kind of clear that mental fog that sometimes happens when you're staring at something for hours and hours on end. And it's actually the proper way to breathe, but most people, especially when we're in stressful environments, our accessory muscles and all those other muscles start to sneak in, and then that's when you start to get the shoulder issues and then your chest kind of hurts. Last exercise, last actual stretch I wanted to show you that I actually forgot about is tilting your right ear to the right shoulder. Then you're going to take your right hand and you're going to put it on your left clavicle, which is that shoulder, that bone attached to the shoulder. Then what I want you to do is I want you to look up and tilt your head slightly back, but you're going to look up to the left. Now you guys should feel a pretty big stretch in that neck, the front part of the neck there, and that big band, this big flat band here. So right ear to right shoulder, tilting your head back and looking up towards the left. And you should feel a good stretch there. Now, if you want, you can add a little bit of overpressure to the clavicle with your hand, but almost like you're pushing away. So you're gonna kind of push your shoulder away. That's what we call an SCM stretch, especially for you guys looking at a computer screen all the time. These muscles get super tight. And so again, you're gonna tilt left ear to the left shoulder first, and then you're gonna look up to the right. And then you're gonna take that left hand and put it on your right clavicle. And that's a good way to keep that front musculature stretched out so that you can get that nice stretch. All right. Any other questions for anyone? Would everyone be interested in the little minute mobility minute series that I created? I'm happy to put that together. I can kind of do like a little video to walk you through it, and then I can give Rachel the link to post whenever. Okay.
That would be very
Well, thank
great.
you guys very much. And if you
People-
need any physical therapy, please consider our clinic. We're right in Towson, right behind the Applebee's, and we're actually the second building behind the Geno's, right in Towson.
And what's the name of the practice?
It's called Optimum Performance Physical Therapy. We're a small clinic, but we really take pride in our patient care. We are not a chop shop like some other places out there. I know from my husband doing personal injury that it makes me twitch when I see some of the medical bills, and or if I see things that are just not ethical. I will guarantee you that our place is very ethical. We don't waste money. We always work with our lawyers. My front desk manager is, she's a machine, and she just gets stuff out in a timely fashion. I think my husband can attest to that because he's had a couple things with her. But my boss, I've already talked to him. He's willing to negotiate like, fees for copies of things and things of that nature. We would love to come to your office and just have a meeting or meet for lunch, or even have you just stop by and see our clinic just so you can kind of get to know us. And that way, if you have a patient that you think would be a good fit, we would love to help them and treat them. So thank you guys very much for giving me the opportunity to talk.
April, thank you very much for your time.
Sure.
And everyone, if there aren't any other questions, that's going to conclude today's session and the virtual wellness program, which I think overall went well. And look forward to continuing it later on or in the next bar year. So,
All right.
Well,
Let me know. I would be happy to help.
great. Thank you.
Have a great day, everybody. Thank you so much for your time.
Thank you.
Bye-bye.
Bye-bye.